Um, okay, the committee, how can we start now? Okay, yeah, because of everyone is already in the Zoom and the speaker is also already joined the Zoom. So let's start this session. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So good afternoon, ladies and gentlemen. Welcome to International Virtual Lecture in Business Management and Entrepreneurship in Healthcare that held by Center of Excellence in Higher Education for Pharmaceutical Care Innovation, Universitas Pajajaran. My name is Miski, and today I will be a moderator of this lecture. And on behalf of organizing committee, I would like to thank you all for joining us, and I hope you will have a great time during this session. So ladies and gentlemen, we will talk about geospatial data science. As we know that geospatial data science is now a booming niche. However, learning geospatial data science can be a daunting task for both novice and intermediate users. The learning resources and path for this specialized field are less known and less shared compared to mainstream data science resources. Therefore, we are greatly honored to have Dr. Zara Shabrina to talk deeply about geospatial data science in the healthcare industry. And can we learn from the platform economic? So before we start her lecture, let me introduce the speaker first by looking to her CV. So this is Dr. Zara Shabrina. She's achieved her PhD in Center for Advanced Spatial Analysis, University College London. And she also finished her master in urban planning in University of Southern California, USA, and graduated also from Institut Teknologi Bandung, Indonesia. And her research interest is in intersection between data, technology, and the new economic geography, which makes up the digital geography, including the quantification of the socio-economic impact of online platform economic adaptation in cities, digital economic and platform inequality in developed and developing countries, and also about the social media data mining, analysis, and visualization. So welcome, Dr. Zara Shabrina. How are you?
Thank you very much, Miski. I'm fine, and I'm very glad to be here and to be able to share some of my knowledge and expertise for UNPAD. Thank you.
Thank you. So let's start the session. The time is yours.
All right. So first, let me see if I can share my screen. Can you see my screen?
Yes.
Okay. So that's great. So hello, everyone. Good afternoon, and thank you very much for coming to this International Virtual Lecture. And also thank you for Pharmacy UNPAD for inviting me in this sharing session. And today I'm going to talk about geospatial data science in healthcare industry. Can we learn from the economy of platforms? And my name is Zara Shabrina. As Miski already introduced me, I am an assistant professor in spatial data science in Department of Geography and Center for Urban Science and Progress at King's College London. Let's see, just a sec. Okay, so for the next, so hopefully 45 minutes, I'm going to talk about geospatial data science and then how it can be applied to healthcare industry. This virtual lecture will be interactive. So I will be using this app called Poll Everywhere. It's a very useful online service that allows educators, presenters like me to ask students or audience or participants question. And then if you go to pollef.com/ZSKings, you will be able to look at the question, and then you can select some answers, and these answers will be shown in my live presentation. So first, before talking more about the topic, I would like to know more about who am I talking to, where you are, what is your background. So I'm going to ask you just a bit of series of questions so it can give me some ideas about who you are, and so then I can tailor my presentation. So hopefully it will be more useful to you and to your background as well. So for the first question, I think it would be good if you are able to show me where you are. So you can place anywhere in the map, and I can see some people already show that they are in Bandung, Jakarta, lots of people in Java. We have some people also in Kalimantan or Borneo, and then in Sumatra as well. And if you live abroad, just place it anywhere outside Indonesia. Okay. So I can see there are lots of good mix of participants here. I can see participants, most of you are in Java Island, maybe Bandung and Jakarta. We also have from Semarang. And then we have people from Borneo. Let's see. More and more people. So this is really good. So the participants are everywhere in Indonesia, which is one of the purpose of Campus Merdeka, I thought, so that everyone can have a chance to be able to be involved in this kind of lecture. And we have some people overseas as well. And so thank you everyone for coming. There are a good mix of people here, and I welcome every one of you, and hopefully we can have a good session, good discussion as well. So let's move on to the next introductory question. So this is just to know who you are. Are you like students? Are you students from Unpad, other students from other universities? Are you professionals, general audience, academic staff, and see what are the proportion of our participants here. So most of your students from Unpad as well as other universities. We have just very small proportion of professionals as well as, let's see here. Yes, students, international students as well. So we have small proportion of international students and professionals. So this is great, but most of you are students from Unpad. Just going to see it a little bit more. Okay. So now we know who you are, and we have a bit of professionals here as well. So during the lecture, if you think that you want to share something, say something, you can raise your hand, you can put it in the chat box, you can unmute yourself and yes, and voice your opinion. Okay, this is good. So now we can see that actually the other students outside Unpad makes up the large proportion of the audience as well. Okay, thank you for sharing those. Okay, this is the last one, just to know who you are in your academic, professional, general background in one word. And so if you have like 2 words, just use a hyphen. So the word cloud is quite diverse. So the thing about word cloud is the more people answer a question. So for example, student here, the proportion is so big because perhaps more than like 50 people actually answer that they are students. We have lots of pharmacists, pharmacy student, and then lecturer as well. So if you're a student, it would be good to also tell me in greater detail, what is your major, your degree? Are you a pharmacy student? Are you an engineering student, business management? I think that would be good to get that level of detail in this, just so I know who I'm talking to. Yeah, so most of you are pharmacy students. Toxicologists, wow, interesting, okay. Yeah, do you have doctors here? Do you have engineers, business students, or anyone from anyone, the professional? Do you work for startup? Just a little bit more. Okay. Pharmacist undergraduate, pharmacist student, scientist, lecturer. Yep. Okay, so if I understand here correctly, lots of you are in the health, learning about health, pharmacy, and not so many in other discourse. So then I'm gonna talk more about how we can relate whatever it is that I'm gonna convey to you into health related aspect. Technician. Okay, so thank you so much for this. So we know who you are right now. We know where you're located all over Indonesia. We know also that most of you are students. So let's start the lecture. Okay, so thank you very much for participating. It's good to see who I'm talking to. It's always good to know, and that it's good to know that you are everywhere as well. So in today's lecture, I am going to talk about several things. I'm going to talk about the history of spatial data and health, and why perhaps we should think that spatial data science and health is not really something that you can separate. I'm going to talk about John Snow, which is the father of epidemiology, and his cholera detection. And so I'm going to talk a little bit about understanding data science. And then in terms of data science, what is it? To move into this geospatial data science and geospatial AI, because it might be some new terminologies for you. I'm going to go through some of the definitions of the terminology, so hopefully you can relate to your own expertise, to your own studies. And oh, I think someone unmute. Okay, thank you so much. And I'm going to also talk about geospatial AI for healthcare industry and see how geospatial AI has been used to support healthcare industry, and then the relevance and opportunity for Indonesia. And after this lecture, hopefully you get a little bit more knowledge in terms of geospatial AI. At least when people talk about, ask you what geospatial AI, you would be able to answer it quite confidently. So I'm going to talk about the history of spatial data science and health. So the relationship between spatial data analysis, visualization, and health can be traced back as early as 1813. So John Snow is known as the father of epidemiology. I think he's also the father of anesthesia, and he is quite famous for his cholera map. So in the past, London had suffered from cholera outbreaks around 1832 to 1849. It killed more than 14,000 people. And Snow hypothesized that cholera was spread by an agent contaminated in water. However, at that time, all the other doctors and scientists thought that he was on the wrong track, because they have this popular belief that cholera was transmitted through air. So if you breathe vapors or miasma in the atmosphere, if you breathe bad air, then you can catch cholera. But John Snow said that wasn't the case. It's actually water, but no one believed him. He published his theory in 1849 in an essay titled On the Mode of Communication of Cholera, and also mentioned that cholera is transmitted via water and not air. So this British doctor, because he couldn't convince other doctors and scientists regarding his hypothesis that when people drank contaminated water, you can actually catch cholera. So he began a series of investigation, and he actually found the patient zero. It was a mother that washed her baby's diaper in a town well. And afterwards, there was an epidemic in 1854, and it actually killed around 600 people. So how he convinced other doctors and other scientists, he began by making a map. Let's see. Oh. So he began by making a map. This is the area, which is the Soho area where the outbreak happened. And here is the pump that John Snow suspected was the source of cholera. So it's around here. And what he did, he started to map out the area. He started to create charts to see how many cases of cholera in that area. So it's a really simple map. He goes around the houses, goes door to door, ask, is there any case of cholera? If there is, then he put it on the map. And then he see there is a concentration in this central area. However, he found lots of anomalies in his map. So the first anomaly was a workhouse. So this one and this one, they're the same map. And in this first map, he looked at this workhouse, in which workhouse is a prison at that time. So it's really close to the pump, but there was no case of cholera, almost no case of cholera. So John Snow asked about the source of the water, and they say that they have their own wells, so they do not use any of the water from the pump. So he was convinced then, okay, because they had their own source of water and the water was not contaminated, and that's why there was no cholera case. And then he also had another anomaly in which there was a brewery close to Soho, but also they escaped from getting cholera. So he did an investigation, and they said that the men didn't actually drink the water from the pump because they drink the drink from the brewery itself, and it was boiled to a very high temperature. And so there was almost no case of cholera here as well, despite the proximity to the suspected source of cholera. And so he also tried to look at another anomaly in which there was a niece and her aunt, and actually the niece got cholera even though they live far, far away. And then it turned out the niece went on the weekend to visit this area and also drink from the pump. And so, okay, so after a series of investigation using the mapping and analysis, he was able to uncover that cholera was indeed caused by contaminated water, and it might be because of this source over here. So then, I'm sorry, this keeps getting. Okay. So afterwards, he suggested that, okay, or he believed that his new hypothesis was correct in terms of how cholera was transmitted, and then he provided evidence. And because due to his mapping and talking to people, he was able to figure it out. And he argued that an intervention was needed, and to prevent additional cases of cholera, they need to remove the handle from the pump, and cases began to decline. So in a sense, that was how data analytics has been used in the past in order to investigate something, and the use of mapping is also very useful in healthcare. So if we think about the moral of the story and fast forward to the present, what John Snow did, in a sense, is a very basic approach of spatial data analysis that would be the birth of spatial data science. And it was born due to the necessity, due to his investigation of an epidemic. And now I'm going to talk about what spatial data science is, but beforehand, we need to be able to understand what data science first. So data science is a process. It's a comprehensive process in which we have the ability to take data, understand it, process it, extract value of it, and visualize it to communicate our analysis. And this is a very important skill, regardless your background. It could be you have a background in engineering, in pharmacy, in health, you're a doctor. Having the ability to do data science can actually help advance whatever it is that you're currently working on. And that's just one side of the coin, which is data science. Another side of coin is this discourse that is called geographical information system. So it's basically a mapping process utilizing software that is designed to store, retrieve, manage, display, and analyze all kinds of geographic or spatial data. So when we talk about geographic data or spatial data, it just means is that any data that has location attributes attached to it. So for example, if we have data in terms of the spatial population, and then we have the data in terms of where all the health facilities are located, we would be able to do some analysis using GIS to be able to identify the catchment areas for hospitals, it might be for drugstore, it might be for apothecary, and so on and so forth. And utilizing different kind of data, so data of how many people are living in that area, how many health facilities are available, how long does it take for people to actually travel from their home to the health facilities, could help identify and understand how health facilities are distributed, for example. And geographical information system can enable those processes. So what happened when we actually combine the two, GIS with data science? So GIS, we understand it's the framework to analyze spatial location data. We can, it could be through mapping, through visualization, and data science involves all this process of analyzing, manipulating, and visualizing data using programming language. So it could be using all kind of programming language, Python, R, and so on and so forth. When we combine the two, what we have is actually this new field that is called geospatial data science. And using geospatial data science, we can generate insight using algorithm, using analytical techniques. And what we get is that we have this analysis using spatial data in the process. And why is this relevant for analysis of healthcare, for example? We live in the era of pandemic, global pandemic. It's very important to understand where things are, where events occur. For example, we have this dashboard by Johns Hopkins University, and it has been used by lots of people in the world to understand what are the spread of COVID-19 globally, and to understand how to mitigate the COVID-19 spread. So geospatial data science enable us to understand, to analyze, to visualize all these kind of problems using spatial data and health data. But then we can even take it a step further to be able to use geo AI or geo artificial intelligence. So what is the difference between data science and for example, geospatial analysis and geospatial geo AI? So artificial intelligence is a field that combines computer science and big data set to enable problem solving. So there is a process in which we utilize machine learning to be able to analyze and refine the scope to learn what do we need in order to answer some spatial problems. We can model and capture the environment around us. We can link the location in which we live and work and how we can interact with people. We can explore the potential role in terms of the influencing health outcomes. For example, instead of just analyzing where COVID-19 are located, the COVID-19 cases are located, we can start predicting where they will be next. So it's it's very useful for what if scenarios. For example, what happened if we don't have a stay-at-home orders? What happened if we open a restaurant? What happened if we open the public transport with 100% capacity, 70% capacity? So this kind of geo AI can actually evaluate potential policy decisions, and working with spatial data scientists and then healthcare professionals could enable targeted policy decisions. Now, we have talked about all this, right? We have talked about data science, how we can link data science to healthcare, and then we talk about how can we advance it forward and really look into trying to also incorporate machine learning and artificial intelligence for healthcare industry. And now, how about Geo AI, the one that we just talked about, and can we use it as a basis for disruptive technology by creating, for example, any kind of digital intervention that would be able to disrupt healthcare industry. And this could be more relevant to you in terms of trying to link it to entrepreneurship and startup development and so on and so forth. So we live in this era in which digital disruption has already happened. There is a huge reliance of technology. We currently live in the era in which tech companies are everywhere, right? Most of them do not own tangible assets. So if we think about Gojek, they do not own all the motorcycles. It's actually what they do is actually they connect people with motorcycles with people who needs a ride to certain locations. And it's the same with all other digital disruptive companies. For example, Uber, they also have the same thing. They do not have any of the taxis. Airbnb, they disrupt hotel industry. They do not have any hotels. It's people's houses that being rented out in the platform itself. If we look at any other kind of things, for example, Netflix, they don't have any cinema. They actually collected it using the digital platform to be able to provide service. So then Geo AI could also be the basis of disruptive technology and could be implemented as well in healthcare industry. So I'm going to show you a video in terms of what kind of future that Geo AI might be able to provide.
So if you want to think about the future of medicine and what that entails, think today about the largest car company in the world. Uber doesn't own a single car. Think of the largest hotel chain in the world today. Airbnb doesn't own a single hotel. The biggest medical systems in the future are going to own no hospitals. It's going to be devices that are monitoring the lives of millions of patients simultaneously, that's looking to see, do you have the beginning signs of a cancer emerging, to not treat the cancer, but to prevent the cancer from ever occurring. Like that day is definitely coming.
So throughout this video, we can start to identify the kind of opportunity in terms of utilizing Geo AI in healthcare industry. So for example, by utilizing big data and platforms, digital platforms, there are tons of opportunities for utilizing big data in healthcare or Geo AI in healthcare. We have now more than ever the need for telemedicine, for example, or telehealth, in which we can talk to doctors remotely. So there should be, we should be able to do like virtual care, and there is an opportunity to do wearables in which doctors or people in the healthcare facilities can monitor our health, because we have access to lots of smart devices, and utilizing it would be able to create this opportunity and in terms of creating the next tech-enable startup or tech-enable entrepreneurship in healthcare. Healthcare utilizing technology could decrease healthcare costs. It could, for example, telemedicine, it could decrease the pressure for health system. And GeoAI could enable health trend analysis, so trying to catch what would happen instead of mitigating health, but also trying to say if this is the lifestyle that you, if this is the intake of your food, the kind of intake of your food, if this is the lifestyle and no exercising, then you have more risk for this kind of disease, for example. It could also help personalize medicine, identification and tracking. It could help studying drug efficacy, preventive care, and so on and so forth. And yes, there are lots of opportunity in applying GeoAI to healthcare. So what we have nowadays is the rise of AI-based health startup, for example, telehealth. We have Alo Doctor in Indonesia, but there are opportunities to bring it even further and implement machine learning and artificial intelligence to be able to create services that is smart, that is responsive, and that is suitable for the need of the patients. I'm going to give an example, which is Echo. Echo is a California-based startup. It has built this platform that utilizes sensors and machine that can remotely monitor patients with that has cardiopulmonary vital signs, so they can detect the heart and lung problems quite early. I'll have a short video as well for this.
Telehealth is an essential tool in our collective response to COVID-19. Remote virtual healthcare can deliver high-quality care while reducing high-risk exposure to infectious diseases, but it is only effective if providers can get the critical information they need to examine their patients. Echo is the only platform that live streams stethoscope sounds and EKG in real time between patients and providers. The platform has embedded video conferencing, but can also work alongside most existing video conferencing platforms a health system may have in place. Echo's mobile application is easy for patients to use. With only a single click, patients at home can start sharing sounds and EKGs with their providers. Direct-to-patient telehealth with Echo keeps patients connected to their care teams from the comfort and safety of their homes.
So this kind of health startup is very useful, especially in the world that we live in today, because then the challenge for telehealth is that doctor can only see us via the screen. They cannot really listen to, for example, our heart. So they cannot do direct physical contact. And if we were able to produce any wearables that can be cheaply produced, that can do this kind of thing from the comfort of our own home, then it could advance, for example, the patient and doctor interaction, even though it's done remotely. So there's another kind of the rise of AI-based health startup. If we trace back to 2019, actually Blue Dot, which is a Canada-based artificial intelligence startup, they pick up this anomaly in terms of there was a cluster of unusual pneumonia reported around a wet market in Wuhan, China. They were able to detect it using GeoAI before the World Health Organization made a formal announcement that there was an emergence of novel coronavirus in China. So this kind of detection is quite important, something that can be done early in order to detect unusual cases. So Blue Dot claims to protect people around the world from infectious diseases, and they are using GeoAI to do this.
I'm Lindsay Bryson. I'm the Chief Operating Officer of a company called Blue Dot. We're a digital health company that tracks the spread of infectious diseases globally and assesses their risk of spread and impact worldwide. What we've done at Blue Dot is we've built a global early warning system for infectious diseases, and there's 3 pillars to that. So the first one is global surveillance for infectious diseases, and we are mapping out over 200 diseases in near real time, 24/7, processing over 100,000 articles a day in over 65 languages, just to understand what's happening. And that's using our AI-enabled machine. Second is understanding what the impact of spread is going to be. So where are these diseases going to spread to, and what is going to be their impact once they reach their destination? And then finally, we essentially communicate this via our software platform, alert our clients of this early warning in the locations of interest so that they can better inform policy decisions and be prepared for these outbreaks. During COVID, on December 31st, we picked up news in a Chinese local newspaper, translated it into English, that essentially warned of this pneumonia-like disease that we were seeing in a food market. We quickly realized there were some similarities to SARS, and within minutes, assessed global spread looking at air travel to understand where the dispersion might be globally if this was going to turn into something bigger than it was. So on that same day, we were able to alert our clients that there is this risk of a SARS-like illness that could spread. And that was our first alert on December 31st. And then by January 14th, we had published this in the academic literature and correctly predicted 10 out of 12 of the first cities that were going to see their first cases of what is now known as COVID. The focus that it's changed for us is that we now have to really think about and focus on domestic spread. So it's no longer about how it's going to transcend borders and spread globally. It's really about how the outbreak is manifesting in your own community. Hospital and healthcare systems and businesses are realizing that they can't be reactive to these outbreaks and that they're going to need to put systems in place so that these pandemics do affect everyone globally.
So what we can emphasize on the video is that right now we can't be reactive to things. We should be able to predict what would happen next in order to be able to get the best response to what might happen. And this could only be done if we incorporate this type of analysis, this type of predictive analytics, and work together between, for example, spatial data scientists and healthcare professional to be able to tackle, to be able to guide our policies, navigating ourselves throughout this global pandemic. And it's not just global pandemic, but also all kind of healthcare problems, healthcare issues that are raising in our world. In order to do that, however, we must emphasize that all kind of geo AI platform should follow the data ethics principle, because anyone who collects, who shares, who uses data, especially regarding human participants, they should be able to work in ethical manner. Data should be anonymized, in which there is no, we shouldn't be able to distinguish, for example, individuals if it's if we use it for pattern detection, for aggregate analysis, and so on and so forth. And if you're working in this kind of platform, then it would be useful to look at data ethics canvas. It's from Open Data Institute, and they have this framework in which you can look at, you can self-assess the kind of impact that the platform's geo AI analysis, data collection, all kind of process that you've done, and how this might have potential harm, potential bias. Does it serve the public good? If you're sharing the data, is it ethical? Have you done it in an ethical manner? Have you anonymized the data? Have you try to mitigate the risk to any of the individuals? And this is such an important topic in data science, spatial data science, artificial intelligence, startup development, because we need to be able to develop something that is ethical, that protects people's privacy and safety. So what is the relevance with Indonesia? So we look at this startup, it's a fancy startup, it's located in an international setting. How about in Indonesia? So it has huge relevance with Indonesia case because we have a flourishing startup ecosystem. Tech-enabled solution is highly relevant to Indonesia. So if you look at the around us, there are lots of emerging startups, and these emerging startups are supported by lots of different elements. If you look at this document over here, it's the Indonesia Entrepreneurs Ecosystem Mapping 2021 that listed key players in the ecosystem in terms of building the foundation for startup to make a positive impact through tech-enabled solution. It supports the process from seedlings to self-sufficient organization. For example, we have supporting organizations that play a fundamental role in creating the startup ecosystem. We have accelerators, we have incubators that can help facilitate the founders on how to polish ideas, connect with wider ecosystem, etc. We have supporting academic institutions with dual roles for both research and incubators as well. We have established technological companies, and they might be able to provide mentoring, access to markets, potential for collaboration, perhaps funding as well. We have associations on various themes. So the ecosystem startup in Indonesia is quite good and established. This is not my area of expertise, so if you want to know a bit more, then I would suggest that you look at the documents in the link that I have provided over here. But we also have investing organization. For example, banks has become significant contributors in Indonesia in supporting entrepreneurship ecosystem. They provide capitals, incubator programs, and perhaps also government bodies actively supporting entrepreneurship through startup supports, grants, and incubators. So all these kind of resources that can be used in order to support this tech-enabled solution. So we need the ideas, we need to gather the people who can actually do it and just roll it out to support the healthcare industry in Indonesia and utilizing this Geo-AI elements. Another possibility would be to collaborate with already established technology. So for example, Gojek, I heard that they have this geospatial visualization platform, and because they have this daily data in terms of where people go, come and go, pick up and drop off, and this data can then be used to see where the locations where people are located, where the origins are and destinations are. And this information from ride-sharing services might be able to be used as this novel source of data to add to this big data pool for health analysis, because location is a key aspect to see people's movement, and it might give insight for mobility data. And this kind of information can be used to address queries, for example, the spread of virus in a case of pandemic, where people are going, is there any concentration in several areas, is it possible to do social distancing, and so on and so forth. So this could be the potential in terms of collaborating with the established companies. So those are the things in terms of Geo-AI and healthcare. So there are several key takeaways. So the first one would be that geospatial data-driven approach for advancing healthcare industry is the future. We need to be able to grasp it now to be able to compete globally, because now it doesn't matter where we are located. It's quite easy to provide technological solution to healthcare and non-healthcare problems. Big data analytics would allow knowledge creation that can open massive opportunity, and we have identified this kind of opportunity in this lecture. And GOI in healthcare should be done ethically. So it needs to be pursued with data ethics in mind to protect privacy and safety. And we do need generation of tech-enabled startup ecosystem to improve Indonesia's future health industry. And it could start from students, from having ideas. It could start as simple as having ideas and having the appropriate knowledge as well to deliver that ideas. Okay, thank you so much. And so that's it from me. And if you do have any questions, I'm going to give it back to Ms. Kay. Thank you.
Thank you, Dr. Zara Shabrina. What can I call you, actually?
Zara is fine.
Oh, okay, Zara. Okay. Thank you, Dr. Zara. So thank you for your delightful presentation. Is there any question? Before, I also have some questions, actually, but I'm going to ask to the floor first. Is there any question to Dr. Zara? You can just unmute your Zoom and ask directly if you want to. So if you don't, I'm gonna start first here. So Dr. Zara, I wanna ask, I don't know whether this is the basic question or not, but how actually we can collect the data. Then after that, we can put all the data together and become like and can be put in the specific platform.
So can you specify in terms of what kind of data, for example, that you want to?
So example, if in case of the healthcare system, right now there's a holodoc, and I also have some group of students that they want to make a application, then they have to collect like a patient data and then another thing. So in case of geospatial data, how can we collect of all the data and can be put, and what's the most important thing to be notified before we do the geospatial analysis?
Of course, yes. Okay, so in terms of doing GeoAI or geospatial data science to create this kind of platforms that can deliver healthcare service, for example, we need to first understand the need and the problem that we have. For example, what kind of purpose for the platform itself? If the platform would like to provide healthcare services and it would be done remotely, and the first thing that we need to know is the information, perhaps the population in the area in which we want to service, understanding who live here, what kind of like health state, where health facilities are located, who are the target audience that we want to use, and then understanding their demography in terms of their age, in terms of if they're within this certain age, they might need different service compared to if they're in latter, if they're a bit older, for example. So then identifying this kind of data is important in order to create a unique solution to the problem that you have identified. But first, you need to identify the problem first. What is the problem? And then after that, what kind of solution that you can offer? Who will use it? And if that's the case, try to create a mind map. And in this mind map, we can start to identify the kind of data that's available. Is there any government data? Maybe the government has data, the BPS, the Statistical Bureau, that have the data in terms of demography. Is there any data in terms of the location of healthcare facility that could be extracted from open source data such as OpenStreetMap, Bing Maps, and then how people actually travel to these health facilities. Then we can look at the data, for example, using Google mobility data, and that can be accessed. So then we have identified, for example, those very basic data set, right? who are living in this town, how they travel, and then what kind of age mix that they are and how close they are to the healthcare facility. Does that mean that there is a problem that needs to be addressed, perhaps using this telehealth facility? Then we can start building these platforms, and this platform might be able to be used by these people. But then, because technology could enable things outside the physical boundary, you can actually do a technological solution that can be used by everyone, but you still need to be able to identify what are the needs of the people. Is it for people who are experiencing mild symptoms? Is it for people who specifically have health problems or this specific type of disease? So it's really a long process from the beginning to end to be able to incorporate this data analytics for platform creation.
Yeah, I guess maybe some of us maybe know that in Indonesia, actually, the data collection, it's still unintegrated, right? Yeah. So it's really difficult to ask even government data that we can ask, where do we can get the data? Then it's, because it's unintegrated. And what do you think about this one? I mean, how we could, I don't know, how we could improve this problem, in your opinion?
Yes, so data scarcity in Indonesia is definitely a problem that even myself, I'm trying to address this as well. But however, the good thing is that nowadays, lots of data are generated not from official government data. So in my own case, I have used, for example, social media data. So processing the data from social media, Twitter, it could be from Instagram, in terms of trying to see what kind of trends, and it could be using various themes in which people are talking about. It could be about health, it could be about transport, it could be about different kind of themes. And we can start extracting social media data to be able to look at public perception. And there are all kind of, if it's spatial data, this crowdsourcing platform, for example, I told you the Google Maps, OpenStreetMap, Bing Maps, in terms of the locational data, where the healthcare facilities are. We could use, for example, Python programming language to be able to extract all the data in where they are located, and then where they are, where things are located, and even if we go into like Google dataset, we can see which places are visited most often. So do this hospital have lots of visitation? We can also get the data from the search engine. For example, like how many people Google COVID-19 in this day and compared to the last year. We can see, and then people actually start to detect cases of epidemic because of how many people actually Google the symptoms, for example. So there are lots of other data sets. So we shouldn't just rely on government data. We should use it as a basic of our data, but if it's not available, there are all other data sets out there that can be utilized. And it's time to start thinking about all these other data sets and incorporate it into our research to be able to gain more knowledge in terms of like the pattern, the analysis, all kind of things. And I have seen lots of healthcare students, like health students, doctors, pharmacists that have used this kind of data set to actually do their analysis. So it's not uncommon to do that, and they are available and they are quite easy to get as well.
Okay, so yeah, a little bit understand right now too.
Okay, great.
Okay, so is there any questions from the participants here? Yeah, because mostly of students, do you think this is really hard to be understood, or how? Okay, is there another question? Okay, from Petros Bagas Unpad. Okay. Do you want to ask directly, or I just ask here? So thank you, Dr. Zara, for the great presentation. I'd like to ask a question. Beside the unintegrated data in Indonesia, What do you think is the biggest obstacle in the implementation of Geo AI in Indonesia, especially in the healthcare sector?
Thank you very much for the question. I think this is very relevant because the biggest obstacle is actually the skill. So I think Indonesia need more people with the skill to be able to do this kind of analysis. And the good news is I have met more people that is interested into becoming spatial data scientists, and the background is quite diverse. I have seen pharmacists that have actually explored data science. I have seen doctors. I have seen lots of people from different backgrounds. So if we have more people with knowledge in terms of like programming knowledge, analysis, spatial analysis knowledge, and also this kind of soft skill that could be implemented to launch this Geo AI startup, I think that would be the best. That would be the best scenario. So try to also people who understand in terms of, because when you do Geo AI, you kind of deal with a huge data set, and dealing with huge data set is not an easy task to do because it involves a lot of data processing, data cleaning, before even go to the data analysis. It might take a long time to look at the unstructured data and get a pattern to it. So it's the kind of skill that needs to be gained. It's the kind of skills that needs to be keep continuing. We have to keep doing it to be able to get used to extracting pattern from the big data and then try to analyze it to get a meaningful result. So I think more people needs to know about this Geo AI, not just people that works in computer science, because this is really not the time to be like, if you're in computer science, it's the only computer scientist that can do all this. No, because people with different backgrounds should be able to do it as well, to incorporate informatics, computer science into their own research, into their own expertise and areas. So that could be the obstacle and opportunity and kind of like the strategy that should be implemented. So 3 things in one question. Is that clear? And feel free to elaborate any of this and turn on your camera and talk as well.
Okay, so how about that one? Petrus, is that enough, or do you have another question? Okay, okay. Another question is, dear Dr. Zara, to my experience, people oftentimes associate data capture for this database, while indeed serving a noble use as means of surveillance. How do we make sure that these data we gather, example through COVID-19 tracking apps, are used in line with public interest?
Yes. So Kevin, this is also a really good question. And it's a question that has been asked all the time, because there's always the fear of surveillance, of data privacy, data security concern regarding data collection, especially if it's in individual level. So actually lots of ways can be implemented to ensure fair principle in terms of data collection. That's why I brought up the data ethics canvas, because then we can start to look at this in terms of, if we were to collect individual data set, it needs to be done in a way that is anonymized, that is protecting individual privacy. One of an example is the COVID-19 tracking in the UK, in which we put it in our phone. However, we actually generate like unique number every 15 minutes. And then this unique number is then collecting the data, but it has never been associated with the account itself. So it's a whole process, a whole complicated process in terms of collecting data, but still ensuring anonymity. And creating this kind of a platform requires a really good understanding of data ethics as well, because then once you can identify someone through aggregate data collection, it becomes a security concern, and it's not ethical anymore. So having this guideline is actually quite useful in order to in order to ensure that the clash between safety, privacy, and data collection for example, GeoAI can be met in a more fair, in the most fair manner. Is that clear?
Yeah. So in that, really interesting. So, okay, another one again from Petrus. So basically, human resource is one of the key points in implementing GeoAI, right?
So, what do you mean human resource here?
Okay.
Is it human participants? Is it human data?
Petrus, can you directly unmute your features?
Okay, thank you so much, Ms. Miski and Dr. Zara. So basically what I mean is by human resource is that we need a lot of people who are skilled in data science for implementing GeoAI in healthcare system, right?
Yes, yes. So more people should, and if you're interested in GeoAI and interested in data science, I think regardless of the background, you should pursue it regardless. Yes.
Okay, thank you so much, Dr. Zara.
Okay. So we have a question from Rayhan as well.
Yep. So yeah, so far in example from presentation, the analysis step of geospatial data science from Jon Snow is pretty much about making hypotheses, collect data, analyze data, and then present it. I'm a bit confused about how would an artificial intelligence would be involved or help in this process, or does an AI would randomly generate analysis on its own? Because to my knowledge, an AI is something close to an operator or even a brainware.
Okay, so artificial intelligence could advance data analytics, basically. So data analytics is like you get the data, you analyze it, and you present it, right? But artificial intelligence help bring it a step further by, for example, creating prediction into what would happen next. So if we remember the video in terms of the Echo AI, and then what they do is they use wearables in which these wearables could detect the cardiopulmonary patterns, the cardio pattern, and using AI, we could actually look at if there's any anomaly in that pattern. And then, so if the pattern is in certain wavelengths, if the pattern in certain and then it might be normal. If it's not, it might be a sign of a disease or like or anomaly. So artificial intelligence or AI is can actually be used to detect this kind of pattern, because the machine is trained to be able to detect if this is normal or not. And this is something that we need to train the machine to do, because if the machine only show the pattern itself, usually then the doctors will look at the pattern and say, okay, the pattern is normal, this pattern is not normal. But now we can train the machine to do the thing that the doctors can do, that is analyze if the pattern is normal or not. And that is why it is artificial intelligence can be used, because we are training the machine to be able to make that kind of prediction, to be able to make that kind of analysis, and then it could help doctors to see and then to complement the doctor's the doctor's knowledge, and then how they can then treat the patient. So that could be one very simple example. And there are lots of other examples. So for example, for COVID-19, instead of just doing a data analysis where the things are located, we can then start to do prediction in terms of incorporating machine learning and artificial intelligence to see if this is the pattern that has happened in the past. And it depends on the population density, it depends on where the outbreak happens. We can actually start to predict where they would happen next. And that's what the Blue Dot, the Canada startup did. They pick up all these cases of pneumonia in Wuhan, and then they predict what are other cities that might be infected, looking at the travel pattern. And they actually were able to predict 10 out of 12 cities that was infected by COVID-19 immediately. So this kind of analysis, artificial intelligence brings this a bit forward in terms of not just stopping in data analysis, but go towards the data prediction.
Wow. Okay. So Raihan, I think is it enough, or do you want to ask more questions? Okay, if it's enough, then the next question from Olivia. Dr. Zara, I would like to know what are the important knowledge or skill that we have to learn and understand to explore GeoAI and to work in this field. Thank you.
So you need to have programming language. You need to learn programming language, maybe Python, maybe R, and to understand how then you can create some sort of like platforms, you can create some sort of analysis that can that would enable you to use big data sets and do this kind of analysis. So programming is a skill that you need to have. And then statistical analysis. So you need to understand the basic statistics in terms of the analysis itself, because machine learning, they use statistical analysis to do all this kind of prediction. And after you have this programming skill, the statistical skill, and you might also need the mapping skill, visualization skills. However, in Python itself, for example, in the programming language, they already have all kind of already made packages in order for you to do like machine learning, and then using TensorFlow, Keras. There are lots of packages that could help you. So if you want to start to learn programming, I think that would be good, and statistical analysis and so on.
All right. So yeah.
Yes.
Okay, so Rehan, as is enough, thanks. Okay, so we come to the end of this session. So Dr. Zara, do you have any last words for all the students here or other professional about this session?
Yes, thank you very much for listening. And I think it would be good to have more spatial data scientists or just data scientists from the healthcare sector. So hopefully this talk inspire you a little bit into pursuing that kind of career or future at least. And it's been a pleasure.
Yeah, thank you very much, Dr. Zara, for joining us today and give a really delightful presentation. And I hope it become our new knowledge for you all, and maybe next time someone interest become as you maybe. So we'll see in the future. So before we close this session, there's a certificate appreciation for Dr. Zara. Thank you very much for joining us. I hope we can meet again sometime. Maybe someday. Thank you. Oh, it doesn't show. Okay, so this is a certificate of appreciation for Dr. Zara. Thank you very much. And we hope to see you again. So by this giving certificate, I would like to say thank you for all participation. And thank you for all the questions, and it's really good discussion. And yeah, thank you very much, and see you again in the next lecture. Goodbye.
Thank you. Bye.
Thank you. Thank you very much. Bye-bye. Terima kasih. Saya izin leave. Thank you.